Recording in
Good
progress.
morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to today's news conference for the latest in COVID-19 information for the Amarillo community. Let me go ahead and introduce very quickly who is on our panel today. We are joined by Mayor Pro Tem Frida Powell, Dr. Todd Bell, Public Health Authority, Texas Tech University Health Sciences Center, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Emmetier, Chief Medical Officer for BSA, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. We'll go ahead and open it up to our medical professionals who are here on the panel for some brief opening statements. We'll start with Dr. Bell. Dr. Bell, how are you today?
I'm doing well. Appreciate the opportunity to be here. I'm filling in for Director Stoughton on some of the numbers over the past week or so, and so I'm going to actually run through those if it's okay. As of yesterday, in our Potter and Randall counties, we've had a cumulative total of 41,773 cases of COVID that have been reported. We currently have 4,138 active cases and 823 deaths reported as of yesterday in Potter and Randall counties. Our 5-day new case average is at 273 new cases per day. Unfortunately, over the past week or so, we have had 22 additional deaths that have been reported due to COVID, and these will be actually included in today's dashboard. I think that bespeaks the fact that we are in an acceleration phase still of this pandemic, and we see this lag time from the time of when we start to see transmission in the community to when the hospitalization rates go up to when we start seeing an increase in the, unfortunately, in the number of deaths. And our hearts go out to all those who've been affected in this way. We currently are still in level red. All 4 of the metrics that we follow are in the red level. Yesterday, our GA34 hospitalization percentage was just under 17%. Our 7-day rolling positivity rate for tests performed is currently at 13%. And the positivity rate specifically at the city drive-through testing site is at about 29%. I would remind the public that COVID testing is available. You can be tested from lots of different places, including our private providers in town, but it's also available at the health department by calling 378-6300. COVID vaccinations are also available at many locations around the community, at different pharmacies, and also available at the health department. And actually, those are being administered right next to the public health building at 850 Martin Road. We also, as kind of a housekeeping business, we have our TB testing, STD clinic, and regular immunization services are being provided at the health department, but that is by appointment. Folks should call 378-6300 in order to be able to get through there. Finally, in case there's questions about the vaccination rate in our community, our most recent updated numbers, we have 41% of our population over the age of 12 in Potter County that are fully vaccinated, and 42% of the total population over 12 in Randall County that are fully vaccinated. I would take a moment to remind folks that in this pandemic, the tools that we have that we know work best are masks, vaccines, social distancing, and hand hygiene. And we all need to pull together in order to be able to help decrease the risk to life in our community amongst our friends and neighbors. Thank you, David.
Thank you, Dr. Bell. We'll now go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Weiss, how are you?
Hey, morning, David. So I'm feeling a little bit of encouragement. And there's really 3 reasons. First, if you look at the dashboard report card from yesterday, you can see there's a slight downward trend of our active cases in this community. Now, again, it is not nearly enough to call it a genuine trend, but it is encouraging to see that maybe it's not just marching forward upwards as we've seen over the last couple of weeks. Now, relevant to that is the University of Texas has a modeling system that looks at different parameters of the virus in our area. And one thing they reported recently is at the R value. Now, the R value is the reproductive rate of the virus. And if the R value is above 1, that means we're seeing a net increase in the reproduction of the virus. For the first time, it was at 0.96 reported the other day. Now, that there's a significant margin of error, but that is the first time we've seen it below 1 in a while. So again, maybe some good signs that things are improving. But I think the biggest thing I heard was right now, 75% of adult Americans have received at least 1 dose of the vaccine. That's awesome. Right? And I want to personally thank anyone in our community that has joined the club and become a vaccine member. Okay, please, as Dr. Bell and Dr. Lamentier continue to say, that is our best way of preventing this virus. If we want to continue to see that R value go down and want to continue possibly to see that the number of cases in our community go down, there's only the best way to do that is to get the vaccine. So as Dr. Bell said, we're at 41%. Okay, but overall, that means there's a lot of areas in the United States that are well over 85% if we're going to get that 75% average. So please help us all fight this by getting your vaccine. Let's talk about the numbers in Northwest. This morning, we were at 56 positive patients in the hospital. 54 of those patients have not received the vaccine. So only 2 are vaccinated. They're currently in our hospital. Now, that is 11.3% of our licensed beds. That's almost 25% of our capacity right now for the acute care hospital. Now, just put that in perspective, on August 1st, we were at 26 positives in the hospital. By August 15th, we were at 45. It was on August 22nd that we exceeded 50 positive patients in the hospital. And we have been somewhere between 55 and 65 since that time. I mean, I guess the good news is we're not seeing a huge net increase, but we're also not seeing a net decrease. We just continue to hover in the 55 to 65 range. Right now, we have 29 of those patients are in the critical care unit. There are 18 ventilators being used for people who are suffering from COVID-19 pneumonia. And we're using a total of 27 ventilators. So 18 out of 27 are being used for patients suffering from COVID right now. Now, our lab continues to be exceedingly busy in doing testing. Yesterday, we tested 326 people for COVID, okay, and we got 70 positives. Okay, that is 19% of the testing we did. Now, just remind you, it's been since July 16th that we started hitting double-digit positivity rates of our outpatient testing. We've been in double digits since then. If you go back to June, we were down to 2 to 4% positivity rate. So again, we continue to see a significant number of people testing positive as we do a lot of testing. Now, we've talked about the staffing challenges over the last couple of weeks. You've heard it from myself and Dr. Lamentier and Dr. Gonzalez. This morning, we had 24 holds in our emergency room. That's 24 people that were waiting for beds in the hospital. Now, what has helped us a bit is we have received some traveling nurses through FEMA. Now, we now have over 20 ICU nurses and over 20 med-surg nurses, along with a handful of respiratory therapists that have come to travel and visit us through FEMA. And that has certainly helped. Not only are we reducing the holds in our ED, but we also talked about all those holds out in the regional facilities. Then normally these patients would come to us for a higher level of care. Okay? Right now, there's 22 patients holding out in the regional facilities. That's down from almost 40 about 2 weeks ago. So we're trying to get more of these critical care patients in to the higher level care, either us or BSA or the VA to help with that. Now, as Dr. Bell said, unfortunately, since the beginning of September, we have had 9 people lose their lives to COVID-19. Out of those 9, only 1 of those people had a vaccine. Okay, now this gentleman was entering his 10th decade of life, but he had been vaccinated. And there was a recent study that looked at of the people who are hospitalized or pass away who are vaccinated from COVID. The average age is normally about 80 years old, and these are people with significant comorbidities. And I know Dr. Lamentier went through a lot of the patients they saw at BSA who died with significant comorbidities associated with it. So again, the vaccine is very protective. We know that it's only the outliers, unfortunately, that can still suffer severe disease from it, even despite a vaccine. Now, in terms of medications, we continue to use dexamethasone, remdesivir, okay, but there's a new medicine that we're using, I think you're using next door, called baricitinib. Okay, it's an arthritis med. There's a common theme here. We've talked about tocilizumab, and now there's baricitinib. These are both drugs that are used to treat people with rheumatoid arthritis. So why is that? Well, rheumatoid arthritis is an inflammatory condition. Okay? We know that people who get very sick from COVID-19 are suffering from overwhelming inflammation, what we call a cytokine storm. So it turns out that some of these medications that treat an inflammatory condition like rheumatoid arthritis appear to have some benefit in helping reduce some of the inflammation and cytokine storm associated with COVID-19. That being said, they are by far from being perfect, and they're not great treatments. They are treatments. Again, the biggest thing is preventing getting the virus is the best way to go. But we are using some of this new medication to treat patients. This is why I end up by saying that even though we have these models that suggest that maybe we're starting to see a decline in numbers in this area, these models do not take into account the beginning of school and bringing all children together. They also don't account for Labor Day. Okay? We saw a lot of people get together Labor Day, which was great, but I also saw a lot of situations where you could easily see the spread of the virus because people were not keeping distance. Please continue to take those measures that Dr. Bell talks about. The other thing we're seeing is viruses like RSV, respiratory syncytial virus. I'm seeing those in adults now that I've tested. You usually don't see RSV in adults, period. And here we are, it's in our community. So the mask not only protects you from COVID-19, but all these other germs that have come back with a vengeance, they're also infecting people. So thank you again. Please get the vaccines. Let's increase that number from 75% to even higher levels. That's all I have today. Thank you.
Thank you, Dr. Weiss. We'll now go to Dr. Michael Lamentier, Chief Medical Officer for BSA. Dr. Lamentier, how are you?
I'm good, David. Good morning, everybody. And thanks for having me on the news conference again today. I think I'd like to start off with an update on where we are with our statistics, then I'll get into some other comments I'd like to make. We are at 77 hospitalized COVID patients this morning. We have been hovering really in that 77 range now for a few weeks at least. We were up as high as the high 80s, 90 patients hospitalized not long ago. Since the beginning of August, we've been hovering in these 70 to 90 range, I would say, which is a significant burden of COVID patients. Of those 77 we have currently, 35 of them are in the ICU. And of the 35 that are in the ICU, 29 of them are requiring the ventilator, meaning they can't breathe on their own. We had to put them on the ventilator because of the severity of the COVID infection in their respiratory system. So if you combine our ventilated patients with what Dr. Weiss stated at Northwest, that's 47 patients in our community that are on the ventilator because of COVID-19. And I'm sure Dr. Gonzalez is probably going to add a couple. So again, that's a lot of people in our hospitals that are requiring the ventilator because of severe respiratory failure from COVID-19. It's still quite concerning. Of all the patients that we have admitted, this number is holding true. A very high percentage of those are not vaccinated. So as of our tallies yesterday, 89% of the patients we have admitted with COVID-19 now are not vaccinated. Again, significant, consistently showing this every week when we show statistics on the number of people that are hospitalized, the bulk are unvaccinated, the number that go on the vent, the majority are unvaccinated, and the patients that unfortunately are succumbing to the disease and that die, the majority of those are unvaccinated. It's a disturbing trend. Furthermore, we're seeing a younger patient population, as we've said time and time again over the past several weeks. 50% of the patients we have admitted now are less than age 60. And interestingly, although there's 11% of the people we admitted that are vaccinated, I mentioned that 89% are unvaccinated, 11% are vaccinated. A very small percent of those under age 60 that are admitted are vaccinated. Only 2 patients we have in-house right now, 5%. So again, clearly we have less people that are younger that are moving forward with vaccination who are eligible. And again, from ages 12 and above, as we said before with the messenger RNA vaccines, and it's translating to hospitalizations and unfortunately severe disease in some individuals. Right now, we're using 73% of our total ventilator inventory at BSA. We're at 88% ICU utilization as of this morning. As I mentioned last news conference, we have had to truncate and postpone elective surgical procedures that are not urgent or emergent or have a high risk of causing an adverse event for someone if the case is delayed. And it's because of our difficulty with having enough ICU capacity to be able to manage those patients and also manage the COVID burden in our hospital, in our city, along with all the other acute illnesses that require ICU hospitalization, whether it be heart failure or sepsis or pneumonia from another cause, the things that we see day in and day out that lead to individuals, unfortunately, requiring intensive care services in our facilities. Our testing month to date is at 21%. 21% of all tests in September are coming back positive. We finished August at 19%, so we're still rising there a bit. And back in June, we were at a much lower number than that. Back in the middle of the summer, or earlier in the summer, I should say, we were really at about a 2 to 3% positivity rate. So things have really skyrocketed in terms of positives since that time. We do have some state support and federal support with nursing. We currently have 17 RAC ICU nurses and 20 med-surg nurses that are here, which we're very grateful to have, that are helping to support our core nursing group, who has really been suffering the brunt of this burden in our community. We also have travel nurses that we've hired and been hiring for over a year now to help manage these patients. And again, we'll continue to do so to try to have enough staff to be able to take care of the patients that need to be cared for in our community. I want to talk about a couple studies that I think are important that came out this week that I want to make sure that folks are aware of. There's been a lot of debate back and forth about masking in terms of whether it's even effective in terms of preventing respiratory illness or COVID-19. There's a large study that's undergoing completion now and under peer review that was performed in Bangladesh that really involved a large number of people, and researchers at Stanford and Yale are completing this study. But the preliminary results are showing that those folks that are wearing masks, and this was a detailed, rigorous study of observation of individuals in the various communities in Bangladesh, showed that there was about a 10% reduction in COVID-19 transmission for folks wearing masks. Again, it was the surgical masks that were more effective than a cloth face covering, but there was some efficacy for those other coverings as well, just not as good as a simple surgical mask. So again, more data suggesting that masking is beneficial. And I would say more data beyond the obvious when we know that we were masking heavily and that we were really avoiding close gatherings, our numbers were down. So again, we don't have to have all of the studies show us to the nines what the data is regarding masking. We're starting to see that data now, but it also was obvious based on what we saw in our own community. The second thing I'd like to mention is there was a very large study that came out this week that's published in the Journal of American Medical Association that looked at over 6 million people that received the messenger RNA vaccines. They looked at a period of 3 weeks beyond the first dose and 3 weeks beyond the second dose of that 2 vaccination series. And what they determined were that there were no serious adverse health events that occurred in the vaccinated individuals as compared to those who were unvaccinated in the normal population. Meaning, serious events occurred in those individuals like strokes, heart attacks, and other adverse events, but it was no different for vaccinated versus unvaccinated in those patient populations. Again, showing that there's nothing to suggest that there's any kind of significant adverse event that's happened statistically significant fashion for people that are vaccinated with the messenger RNA vaccines. It doesn't mean that you can't have an adverse reaction to the vaccine like anaphylaxis, an allergic reaction. And in fact, the study pointed out that there were 55 cases that were confirmed out of the 6 million that had anaphylaxis. I'll say that again, 55 out of 6 million that had anaphylaxis. And those were individuals that had a previous history of allergy. So they had a known history of either anaphylaxis or severe allergic reactions. There also appeared to be a slighter higher risk for those reactions in females. It's not clear why that happened, but that was something else they noted in this trial. But again, I think the most important thing to comment on here is that in that large number of individuals and patients that were studied, the adverse events were not able to be shown to be more significant or different than the unvaccinated population of individuals. So again, I think we need to just continue to stress primary prevention is the best. Get vaccinated, be smart with what you're doing with masking at the appropriate times and attempting to really avoid your exposure. The Delta variant, we know, is the predominant variant in our nation, in our community. There are additional variants that are being detected in the United States now. You may have heard of the Mu variant. It's MU. There are now, I think, somewhere around 25 to 2,700 cases in the United States. And again, this is just going to be the trend for this virus if we don't get ahead of it with having a highly vaccinated population. So as Dr. Weiss mentioned, 75% of our folks in this country being vaccinated is tremendous. We need to do a better job in our community and in our state with getting people vaccinated. If we do so, the chance of us having significant consequences of this virus on an ongoing basis are going to be far reduced. So I appreciate the time to speak today, and that's all I have.
Thank you, Dr. Lamentier. Let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
I'm doing well, Dave. Thank you. So, the first thing I want to underscore is the importance of vaccinations. Every person on here has spoke about the importance of vaccinations and what it is doing to prevent those getting ill, but also to prevent those who still might get COVID-19 from being seriously ill. And so, at the VA right now, we're tracking about 56% of our veterans within the Amarillo VA healthcare system are vaccinated. That's still quite a bit short of that national average. It's a little bit better than the community, but we still have a long way to go. And so I encourage every veteran out there, if you have not been vaccinated, to please get vaccinated. We can vaccinate you here at the Amarillo VA, the Lubbock VA, but also there's many sources throughout the community available to get the vaccine. We also do offer the booster shot for those that are immunocompromised for our veterans and anyone covered under what we refer to as the Save Lives Act. So that's the spouses of veterans or caregivers of veterans. And so really encourage you to be vaccinated. A real quick look at our numbers. We currently have 6 COVID patients in-house, 4 of which are in the ICU and 1 of which is on the ventilator. So that runs that total that Dr. Lamentier was talking to, 48 intubated or ventilated patients for COVID-19 within the Amarillo 3 hospitals. The other thing I just want to mention here is this Saturday marks the 20th anniversary of September 11th. Many of us can remember what we were doing when we first got news when those events occurred. And for me, I was with a infantry brigade unit, and we were in one of our what we call a command and staff meeting. And all of a sudden, someone came in and whispered something to the commander to let him know that a plane had hit one of the towers. And so, that has caused a lot of impact. And of course, how the war has gone on has caused impact. So I just want to remind our veterans, if you are struggling, and this is also in recognition of Suicide Prevention Month, if you are struggling, please reach out and talk to someone. You can call us here at the Amarillo VA, 806-355-9703, press option 2, or you can call the Veteran Crisis Line at 800-273-8255 and press 1. If you have some needs or want to talk to someone, please, I encourage you to reach out and connect. Last thing I'm going to say before I go is I'm going to reiterate that importance of vaccinations for COVID-19. Please encourage y'all. We're getting ready to come upon flu season. And so I'm going to encourage the same thing with the influenza vaccination. As we start to get that rolled out, please get vaccinated for COVID-19 and influenza. And then underline those same things we've been saying for, I've been here about 1.5 years now. So for that 1.5 years, and even prior to that, I know it was being said before I arrived here, wear your mask, practice social distancing, and good hand hygiene. And with that, I just want to thank the City of Amarillo for this opportunity.
Thank you, Dr. Gonzalez. We'll now go to Mayor Pro Tem Frida Powell. Frida, how are you today? We'll now go to Mayor Pro Tem Frida Powell. I think you're muted, Frida.
Okay, can
Yes,
you
we
hear
have
me
you
now?
now. Yes, we sure can.
Thank
How are you?
I appreciate that. Good morning, everyone. I just wanted to echo the pleadings of our health professionals that everyone in our community should get vaccinated if they can. Most severe illnesses and death from COVID is preventable. It's also important to protect our young children who are not eligible for a vaccine yet. We know the vaccine is safe and effective. So please get vaccinated. It's even free. I want everyone in our community to be well and safe. And again, I echo the pleadings of our medical professionals, and thank you so much.
Thank you, Mayor Pro Tem. Let's now go to members of our media who are in attendance. If you have a question for the panel or an individual panel member, that's certainly fine. I'll go ahead and start with Morgan Durden of KVII Channel 7. Morgan, how are you?
Hello, I'm good. How are you?
Good, thanks.
So my first question is for Dr. Weiss and Dr. Lehman here. Have you guys been seeing patients with flu and COVID-19 co-infections? And can you explain, the symptoms or if it's more severe if you've been seeing this?
Morgan, I'll say we have not seen any of those cases yet. I fully anticipate that's coming. And we did see them last year, and that is a bad combination. But right now, we have not seen much prevalence of flu. Again, what we are seeing is I've had a couple of patients with COVID and RSV, which is not a good combination either. But right now, flu is still pretty inactive in our community.
And I would say the same, Morgan. We have not really seen significant flu cases yet. We're not yet into formal flu season. I'll remind folks that our first COVID patient here over a year ago was a combination of COVID-19 and influenza. And unfortunately, that patient succumbed. And I agree with Dr. Weiss that the combination of an acute influenza infection with COVID-19 is a very concerning combination and is going to have a high risk of mortality, especially for individuals that have any kind of immunocompromised state. But even for those who do not, if they are not vaccinated against COVID-19 or the flu, they are going to be at high risk for severe disease and potential mortality.
Thank you. And my second question kind of bounces off of that. Due to the low amount of flu cases last year, I've seen some people say, experts say it's, social distancing, masking that has helped us keep those numbers low. Are you expecting, is there any expectation that these flu numbers might increase this season due to lower restrictions?
I'll take a swing at that. The short answer is yes. We think that this is going to be a much more significant flu season. There's sort of two reasons for that. One of them is that compared to last year, again, there's just a lot less social distancing and less mask wearing now than what we had a year ago. The other is that there is some cumulative immunity that occurs from season to season with the flu. So if I had the flu last year, even if the virus is slightly different this year, I'm not going to get as sick, or at least I'm going to have a decreased risk of getting sick with the flu if I've had flu in the past. Because we basically had a non-existent flu season last year, the risk is that we're going to have a very significant flu season this year. So again, even more important than to be folks getting their flu vaccine in addition to the COVID vaccine.
Great, thank you. That's all I had.
Thank you, Morgan. Let's now go to Aaron Langston of KAMR Channel 4. Aaron, how are you?
Pretty good. How are y'all?
Good.
First question is, it seems over the past week or so, our hospitalization rate has leveled out. Do you think that's a matter of maybe the need for hospitalization has leveled out with the positive patients, or is it the fact that you guys are pretty much near your fill point?
I can start off with the answering that, and then I'll let Drs. Weiss and Bell. I think it's a couple things. Number one, we are still seeing very high numbers of respiratory patients coming into our ER. We created a separate respiratory triage unit, and we track the number of patients that come through there with any type of respiratory symptoms, which obviously could be COVID-19, could be influenza, could be RSV, could be a combination, or it could be another virus, obviously. And we had 64 patients in the past 24 hours come through that unit. We were running in the 30 to 40 patients per day, which is high enough. That's 64 in the past 24 hours is, to me, disturbing. Again, because we're not even in the technical flu season. So I think that that is something that, we have to obviously be concerned about. I do think that our judicious and liberal use of the monoclonal antibodies, the Regeneron, for many patients that are eligible, is helping to prevent a lot of additional hospitalizations. I mentioned on the call last week that we were over 400 plus administrations of Regeneron in a 1 month period of time from mid-July through the end of August, about a month and a half. And really, that is substantial, far surpassing what we did for any month with the prior surge that we had in the pandemic last year. So Regeneron is one issue. I think that folks who are vaccinated that are getting infected, if they present, they're having milder symptoms. And then the last thing I would say, which is the most concerning, is that we have what appears to be a significant number of patients that are dying. So again, those patients that are coming into the hospital that have severe disease that require the ventilator, it is not an uncommon scenario for those patients to succumb to disease. And that is the most disturbing aspect of why the hospital numbers are not rising. I think, and maybe a smaller component, but it's still a component.
Yeah, I would completely agree with everything Dr. Lamentier said. And just anecdotally, I do a fair amount of testing of people associated with the hospital. And just last Friday, I tested 3 individuals myself. All 3 were vaccinated. All 3 tested positive. But I can tell you, I followed them up over the next couple of days, and typically within 48 hours, they all said, I feel fine. I feel much better. So again, we know that even though we're seeing this, 15, 17, 20% positivity as an outpatient, there is still a fair number of those that are vaccinated, and they tend to shrug it off pretty quickly and feel well and be able to get back to their life without needing to be hospitalized. So that's still very encouraging.
All righty, thank you very much. And Dr. Lamentier, you talked about the Mu variant earlier. Have we had any confirmed cases of that here in the Panhandle?
I am not aware of any confirmed cases, nor am I aware of any confirmed cases for our BSA patients. As I had mentioned before, I think on one of these calls, when we send out patient samples for variant testing, it takes weeks to get those results back. And the last variant result testing that we sent back on several patients was all coming back with Delta. I believe the last batch had 1 Alpha variant, but most of them were all Delta variant. And again, I don't think we have enough Mu presence in the country to be seeing significant numbers here. Although the article that I was reading this morning that talked about the heavy presence, in South America, and they mentioned Colombia. They also mentioned El Salvador, and additional Central American countries, and they mentioned North America. California, I believe, had 340 some odd cases of the Mu variant detected, but in total, they said there were closer to about 2,500 in the country. So that's all I saw in that article this morning that I was referencing. But no, we have not confirmed any at BSA of that variant, and I don't know if Dr. Bell is aware of any of that detection.
No, I would concur right now. What we're seeing is almost exclusively Delta with the occasional Alpha. The Alpha is an older variant that's not quite as transmissible, and the Delta has just competed that. And we'll just have to wait and see from a Mu standpoint.
Alrighty. And with some of the stuff, I guess we're seeing from the Mu variant elsewhere, is there concerns that if we see that it could create bigger problems than what the Delta variant has?
I think that when we look at any of these variants, we have to kind of keep in mind that until a variant becomes really well established, it's a matter of trying to predict what the behavior of the variant is going to be. So when we look at the Mu variant, there are signs that make it concerning that it could be very transmissible like the Delta. And there's signs that are concerning that it might be something that could evade the immune system from prior infections or from being vaccinated. But those are kind of in some ways soft predictions. And so it really is a matter of waiting and seeing what the epidemiology ends up showing. What we do know is that certainly those mechanical things like masks, there's no reason to think that they would not continue to be just as effective with the Mu variant as they are with the Delta variant or the older Alpha variant. But again, as far as some of those predictions about immune system and what would it look like and is it as transmissible as Delta, I think that just really remains to be seen.
All righty, I think that has me covered. Thank y'all very much.
Thank you, Aaron. Let's now go to Michael Corvello of the Amarillo Globe News. Michael, how are you?
I'm doing very good this morning. Thank you for calling on me. With the patients that are being accepted, what is kind of like when you go to Regeneron and the antibody treatments, kind of what are how do you decide when to go to those type of treatments? Any of the doctors can answer.
I'll start. As soon as you are known to be infected, if you are someone who is in a category of patients that are felt to be higher risk for severe infection, or as soon as you are known that you are exposed and you're in that same category of patients that are felt to be higher risk, you should seek out your primary care physician to get an order for Regeneron. And if you want examples of who we're talking about that are higher risk, anyone who is 65 years of age and older, regardless of having any health conditions. And then for those that are less than age 65, I would say you need very little to qualify. Hypertension, diabetes, other history of other chronic medical conditions, whether it be chronic lung disease, asthma, kidney disease. And there are a myriad of other conditions that would potentially qualify you for the treatment. That's why you should seek out counseling with your primary care physician about that. And what I would say is that your physician will likely be more liberal with recommending you for Regeneron therapy, depending upon your individual characteristics, than they would be to recommend you not get the therapy. And as I said before, we are not seeing people that get the monoclonal antibody therapy show up in the hospital and translate to severe disease. It's been very effective at preventing that.
Any other questions, Michael?
Okay, I didn't know if anyone else is going to fill it. Okay, we have still a lot of controversy over ivermectin. Have any of your facilities received patients that have taken ivermectin, and can anybody speak to any complications or anything that's actually seemed to work from that? I know that study-wise it's still inconclusive, but have any of y'all had any patients that have actually showed up in facilities that have taken it?
I would say yes, we've had patients who have received ivermectin. Thankfully, the vast majority of them have received human doses of it as opposed to the animal husbandry doses that were being. But again, the studies, there's multiple studies, over 14 plus studies that have not shown any significant statistical benefit to ivermectin given at standard human doses. So we are not giving it in the hospital, but I do know that there are patients who are taking it as an outpatient.
I would say the exact same thing that Dr. Weiss said. I agree 100% with what he said, except I would say one additional thing. And your statements, Michael, were accurate in terms of how you framed the question, but I would say this is not controversial. Ivermectin does not work against COVID-19, period. So anyone that feels like there's a good trial that's been done that shows ivermectin has efficacy, I challenge them to produce that trial, which we would love to be able to critique with you in terms of its validity. So again, I strongly discourage anyone from taking ivermectin. And again, there's no good data that suggests that it's effective. And yes, there are absolutely, we're seeing in the literature now, in our medical literature that is peer reviewed, that folks are presenting to hospitals with ivermectin toxicity. I don't have any specific examples of that here. I do think some of our physicians have certainly been asked to prescribe ivermectin. They have not done so and will not do so because they know that there's no evidence of any efficacy for treating COVID-19.
Thank you very much.
Thank you, Michael. Let's now go to, if I'm not mistaken, Kevin Welch of News Channel 10. Kevin, how are you?
I'm good, Dave. Thank you. Can one of the doctors, or some of the doctors, speak to the level of pediatric cases of COVID in our community?
I actually haven't been in the serving in the hospital for the past 2 weeks, so I'll just speak a little bit from an outpatient standpoint. We are definitely seeing an increase in all respiratory viruses in kids in the outpatient setting over the course of the past couple of weeks. We've already mentioned the RSV. There's lots of rhinovirus, enterovirus going around. Those are fairly typical seasonal things that just add to the overall burden. We are seeing an increase in the number of, this is anecdotal based off my own practice and my partners, but an increase in the number of children who are testing positive for COVID. And we're definitely seeing that we have coworkers who have children who are in school that the children are COVID positive. And that also ends up affecting our workforce. If our nurses are needing to stay home in order to take care of their children, then that puts makes it more difficult to be able to take care of the children in the clinic.
Yeah, I would just say that we have a reasonably busy pediatric service right now, but thankfully we have no children either in our pediatric intensive care unit or on the general floor. Currently, they're hospitalized because of COVID-19.
Same at BSA. We're having occasional cases. We've had several since the beginning of or since the mid-July period through August, where we've had 1 to 2 pediatric patients admitted with COVID-19 in our intensive care unit. At this time, we do not have any pediatric cases admitted. We have had occasional cases also in our labor and delivery unit for expecting mothers that have come in and that are infected. So again, they tend to be intermittent, those cases, I would say, at this time.
Okay, thank you. Jared or Dr. Bell, any word on another infusion clinic?
No, we don't have any word on any right now. We have we've made a STAR request that was denied. We have made another request requesting not staffing for a infusion center, but for DSHS to operate an infusion center, as they're doing in a number of cities across the state. Not a lot, but some that are similarly sized to Amarillo. So we're still working on that.
Okay. On the city's report card, when it lists tests that are pending, those are strictly from the city testing site, right?
Yes, sir. That's yeah, that's through the drive-through.
Okay. And can somebody explain the lag in the reports of deaths? What caused this?
Sure. And a little bit of this is talking in generalities about the system. So I don't know about any particular on these that are going to be reported today. In general, though, there is a little bit of a lag time there. It's when the hospital or a physician is aware of a death that's related to that. There's a couple ways that those get reported. They get reported via the hospital directly to the health department, but they also get reported through the normal death certificate process, and eventually those make it back to us as well. Our physicians are busy, our hospitals are busy, and the health department's busy too. Being able to report accurate data is obviously a priority for all of us, but the reality is that sometimes these lags do occur. We would like to reinforce the idea or reiterate that even though there's going to be a big jump in the numbers of deaths reported on the dashboard, again, these are not necessarily deaths that occurred overnight, but they are deaths that have occurred in the past several days to a week or so. So again, this is not data from 6 months ago or last November that's finally making it through the system. These are friends and neighbors that unfortunately, and families that are suffering a loss right now.
Okay, that's everything. Thank you all.
Thank you, Kevin. This concludes our news conference for today. I want to thank all of our panel members who took the time to provide this information to the Amarillo community. Thank you for your cooperation. This is David Henry, Communications Manager for the City of Amarillo. We'll see you next time. Thank you.